Jillian Jones is a 19-year-old female seeking care today for low mood persisting for several months. Mrs. Jones states she is, in her words, starting to feel down and overwhelmed a couple of months ago, roughly associated with the beginning of class at a local college after transferring from another university. She reports these feelings are consistent but provoked by being alone, specifically when she comes home after school. She reports some relief when spending time with her sister. She has never taken medication for this. She reports fatigue, extreme tiredness with increased sleep up to 14 hours a day, anxiety, difficulty concentrating, low energy, lack of interest in activities, increased appetite, feeling poorly after about herself and her performance at school, and weight gain up to 40 pounds in the last year. She endorses some thoughts of what it would be like to not be here anymore, but reports she does not currently have a plan to end her life or hurt herself, and reports deterrent would be her family. Patient denies headache, insomnia, changes in her coordination or speech, auditory or visual hallucinations, paranoia, confusion, changes in her hair or nails, or temperature intolerance. She has a past medical history of depression and anxiety with a reported similar event in her senior year of high school that resolved with psychotherapy. She endorses she endorses a familial history of depression from her maternal grandmother, but no other psychiatric or neurological conditions in her family, and no other endocrine conditions. Patient is currently a college student with family as a social support, minimal alcohol use, and denies current drug or tobacco use. She has never been sexually active. On physical examination, the patient is in no acute emotional distress. She appears somber, with moments of tearfulness. She's alert and oriented times four. Thoughts and speech are linear. Affect is appropriate. However, her PHQ-9 and GAD were positive for moderate to severe depressive disorder, and mild to moderate anxiety. Given these findings, my diagnosis is major depressive disorder without active suicidal ideation with generalized anxiety disorder, and my differential is adjustment disorder, bipolar disorder, hypothyroidism, and anemia, with my CAM being major depressive disorder with suicide ideation. For my plan for labs today, I would like to draw a CBC with differential and iron panel, as well as a thyroid panel to rule out any physiological or metabolic causes of her symptoms. I would like to, as prescription, refer her for psychotherapy treatment and come to a mutual decision with the patient about pharmacotherapy treatment based on her questionnaire scores and current symptoms. If she decides to pursue pharmacotherapy treatment, I would start her on bupropion extended release, so Wellbutrin XL, starting on oral dose 150 milligrams daily in the morning for 1 week as tolerated, and then increasing to 300 milligrams once daily. Based on the assessment today, I do not believe the patient is at risk of harming herself or others and has a good social support, so I do not believe any immediate treatment is needed in the clinic today. For education, I would educate the patient on both major depressive disorder and generalized anxiety disorder, on psychotherapy and pharmacotherapy, the benefits and risks of medication, as well as the increased risk of suicide ideation and suicide after initiation of medication, researches for immediate crisis and additional support, supportive strategies for mood and anxiety, such as meditation, exercise, herbal remedies, side effects of medication, and effects of medication when mixed with alcohol, and what types of psychotherapy are available. For follow-up, I'd like to see her back in 1 to 2 weeks to assess for symptom management and intervention, and if, again, in 4 to 6 weeks. I would inform the patient to seek immediate care for worsening of symptoms, thoughts of wanting to harm herself or others, seeing or hearing things that aren't there, confusion, dizziness, seizures, rash, itching, shortness of breath, chest pain, agitation, nausea, vomiting, muscles or joint pains, or swelling in her mouth, neck, throat, or limbs.